Straight teeth aren't just about looking good. Here's a benefit to something like Invisalign. Invisalign is one way to get teeth into the proper posture and position. I always say weak teeth are crooked teeth, and crooked teeth are tilting from the pressures of clenching and just time as teeth kind of shift. But healthy teeth are going to stand up straight and they're going to take the loading or pressures of chewing and function when they're perfectly standing up straight. That's their strongest state. So we know teeth are going under over 1,000 psi of force, and we'd like those teeth to stand up straight long term for the longevity of the health of the bone and the gum tissue. When we straighten your teeth, we're not just moving them, we're actually resetting the whole system. We use that term functional structural reset with Invisalign because when we do an Invisalign scan, we're actually getting a total map of the teeth, and we're looking at how the pressures applied are affecting the gum tissue, maybe bone loss, maybe some recession. And so ideally, the teeth would be standing up straight and taking most of the pressure on the back molars, which are much larger roots compared to the front teeth, which are real small. The function of those teeth is not meant to take a lot of pressure in the front. So therefore, Invisalign is a great tool to get the postures of the teeth standing up straight, get the gum lines set to a healthy status, and get a lot of that pressure off those front teeth so they'll stick around much longer for the life of the patient. You had braces as a kid, but now your teeth have shifted. So what can we do about it? I would say the most common case is a patient that has some lower teeth that are crowding, and they're really just wanting to get them straighter for cosmetic reasons, but also functional reasons. Many times we need to actually move some back teeth and get them to stand up straight before we can get that lower crowding in order. Most cases are going to be 3 months or less. Invisalign is a great procedure and a great way to get straight teeth fast. Our Invisalign consultation is a complimentary appointment. Here's what happens at that visit. Here at Trevino Dental Group, we offer Invisalign, which is a great digital way to get your teeth straight fast. So we usually start with some photos, make sure we're understanding the goals of the patient, how they would like their teeth to look. Then we're going to take a quick oral scan, looks like a little iPhone camera on a stick, and we'll get that scan uploaded into the portal. And then usually within a business day or two, we'll have a nice video showing the treatment and how to get those teeth straightened. Usually it's going to last from about maybe 10 weeks to 20 or 30 weeks for more intensive cases, but we'll share that video with the patient and make sure that their goals are being met. And then we'll hit approve, and those aligners will be here within a week or so. If you want Invisalign and veneers, the order that we do them actually matters, and here's why. Many times a patient will want that perfect dream smile for the upper arch, and many times their lower arch might have some minor crowding. Many times we'll combine those two therapeutics with veneers on the top and Invisalign on the bottom. Actually, we really like to start the Invisalign first to get those lower teeth straight. This usually takes about 2 to 3 months minimum. And once we get those teeth straight, then we're able to work on that digital smile design for the uppers and really follow that lower lip and get that design perfect for the camera. Nobody tells you about this part of Invisalign, but here's what you should know before you start. There might be surprises along the way with Invisalign, such as maybe needing an additional retainer. Many times patients will get about 2/3 through the treatment, and one tooth might not turn. Usually it's the lower canines for some reason, but it's not an issue because we just basically scan them into Invisalign again, and we'll get that new aligner here within a week or so. And then we continue right from there. So there's no wires, there's no metal brackets. There's really not a lot of surprises, but when we do have one tooth that isn't behaving, it's an easy fix to just rescan them.